What stands in the way? Is it the system itself?
Well, I think to the contrary, I think it's becoming much more personalized. And the systems that you were just talking about, the genomics, the big data analysis that can be done. There's a lot of data. It's the analysis that has to come in place. That's allowing the medicine to be personalized for each individual, which is very different from what it's been in the past. Looking at etiology, instead of looking at etiology, they're looking at where they're going forward.
Without the same cost that would have come in the past if you individualize it.
Yeah, there's always, anytime things get out of hand, technology will save the day. And I think the costs are still high, some of this new technology is expensive, but that will take care of itself. That will come in line.
I would add to that whilst we are migrating to the new world, this is also all about collaboration. If you look at the healthcare system, we have a payer, we have a provider, actually you have a network of providers, you have integrated delivery care providers, you have a physician, you have a patient, you have a technology company. And what the new system will be enabled with technology, and that will overcome those barriers which we first saw in the consumer world, but then when you go into a medical world, that it's much more about collaboration. When Michael gets access to completely different data, when physicians have access to data of payers, and that can be driven by a world which is in the cloud, if you so wish, that it enables collaboration amongst the different elements in the system.
And it's real time data. It's not something that they're trending. It's what they developed yesterday.
This sounds like a lovely fairy tale so far, but we know in other sectors where there's been disruption, it has changed market share and profits. It's also forced some companies out of business. There's a lot of vested interest when it comes to healthcare. What does this mean in terms of the companies that survive the disruption and just how willing they are to collaborate?
From our experience, so we invest into early stage startups, and our entire thesis is about connecting these startups with some of the largest providers and payers. And what we see is that there's a lot more opportunities for collaboration in healthcare than in certain other spaces like e-commerce, because the providers do have a lot of regulatory knowledge, capital, distribution networks, and being able to invest into those kind of technologies, match them up with corporates, we think is a huge opportunity. I did want to touch for a moment also on regulation, which, when we talk about barriers, the large companies in healthcare do really well at maintaining regulation that helps them. And I think that's something to be very cautious about. In other areas, regulation at the end of the day was not enough of a competitive barrier because consumers, patients at the end of the day will win out. And regardless of regulation, I think we'll see a move toward things like telemedicine, and states in the US that have telemedicine parity laws that actually encourage doctors to try and use telemedicine. You're seeing a lot of increased productivity from those doctors. They're actually being able to bill more, and even though maybe the average cost of a session is lower, they're actually making more money. So I'd say that there's lots of opportunities to adopt technology and actually have it be a win-win on both sides.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.